Good morning and welcome to the COVID-19 talk with local health authorities. I also should say Happy New Year. We have a new person with us, a new health authority from. Welcome, Dr. Sherri Onyiego, and representing Harris County, and also Dr. David Persse representing the city of Houston. I'm Stephen Williams, director of the Houston Health Department. This show is actually sponsored by the Rotary Club of Houston. Thank you to past President Kathy Finninger for providing these questions. Let's get right with it. A lot of these about vaccine. The distribution of vaccine is a bit confusing and appears to be in a bottleneck. The call center didn't work with people trying for hours and not getting through. Some facilities are sending out email links while many residents are trying to figure out how.
Yeah, I'll take the first stab at this. So this has not gone the way I think any of us would have exactly liked it. The state and the federal governments had a good distribution plan to get vaccine distributed across the nation, but an actual vaccination plan has been left up really to the local level, and it's difficult to have a vaccination plan when you don't know specifically who and when and where the vaccine is going to get delivered. So that's caused a lot of confusion. And then in addition, some vaccine providers have gotten vaccine and they've been able to get through their 1A pretty quickly, and so they've moved on to the 1B, while other vaccine providers are still struggling to get through their 1As. And so from the public standpoint, they're seeing some 1B people, getting vaccine, and yet they're not hearing from their provider, and it's causing frustration. And I would just try to frame it this way. These are problems, but these are good problems to have because we have vaccine. As more vaccine comes into the community, we'll be able to.
Absolutely. Are the city and county sites all booked for January?
So we right now our vaccine appointments are booked. We are working very closely with our partners and identifying specific groups, especially as Dr. Persse mentioned, in that 1A and 1B who may not have a provider and they may not have a person or an entity that they can go to. So those are the individuals that we are certainly targeting because we feel like our role should be as a safety net right now. And really trying to ensure that we capture those individuals in the gap that are in that gap.
And actually the same is true for the city of Houston. We're pretty much mimicking the same pattern. Yes, for January our appointments are booked. We're looking at expanded capacity though. Hopefully next week we'll get an increase in shipment of doses of vaccine, and we'll figure out how to open up spaces. Is there a central place to look to see what location is giving vaccine and how to access them? I found a list of what locations are getting them, but not how to sign up. That really speaks to the issue that you mentioned earlier.
Yeah, there's the state has got a link where there's a map that shows with little colored dots where people are, or where entities are getting vaccine, but it doesn't tell. Well, actually, if you look at the legend, you can find some of them are going to be for the public, and some of them are just for their employees. It appears at this point. But they don't tell you when they're going to get vaccine. So there's some dots on there now that suggest they got vaccine, but when you call them, they haven't received any vaccine yet.
Right.
So.
Yeah, that is certainly true. All of this is really related to the availability of vaccine. Hopefully, in 3-4 months, this won't be an issue.
Right.
We did a little back of the napkin math the other night, and if you look at how much vaccine came into Harris County, because it's the numbers on the state website are by county, look at how much vaccine has come into Harris County and the population. There's been enough vaccine to vaccinate maybe 2% of the population.
Right.
So,
Absolutely.
It sounds like not all vaccines are being distributed. Will you give out vaccines to anyone if there's a surplus in a particular place that would otherwise expire?
So right now, we're really following the state's prioritization plan, and so that would be the Phase 1A group, which is healthcare workers, assisted living facilities, those residents, and then the Phase B, including individuals who are 16 and above, and if you're 65 and older with chronic conditions, such as type 2 diabetes, obesity, cancer. So there's a list of chronic conditions. So we are very closely sticking to that prioritization. And so that's the model that that a number of the vaccine providers are following to identify individuals. And so as long as they meet those criteria,
At this point, it does not appear that there are enough vaccines to complete 1A and 1B. Who is in the next group and when will it start? Which group will teachers be in? I'll answer that. Actually, the number of people that are in 1B is 8 million people throughout the state of Texas. And no, hasn't been enough vaccine provided in order to fulfill the capacity for 1A and 1B. And there has not been a 1C category established by the Vaccine Advisory Committee. And the thought behind that is that we want to get down the road with fulfilling 1A and 1B before you put out another population, given the fact that those individuals that are in 1B are likely to suffer more severe consequences if they get COVID.
Right.
Right.
And I think that the county's population that's in 1A and 1B is like 1.6 million. And we've only received, as you mentioned, like a small percentage of that in the county. So
I think maybe the real advice here is for people to be patient.
that's right.
We're getting shipments on a weekly basis. It hasn't been as routine as I think folks would like it to be, but it is coming. And there are also more vaccines that will be introduced.
Yeah, and if I could just one thing, remind people that we've been saying at the federal level and the state level, local, that for the sort of average person to get vaccinated, they shouldn't expect vaccine until April. That has been what so we got vaccine here, and so granted there are people who are elder, and since the 1B came out, that made an expectation that it would immediately be available,
Right.
and that's part of the disconnect.
Other than proof of age, what do I need to bring? What about pre-existing conditions? You're not asking people to bring their medical records, are you?
No. There's no. I mean, the only thing that we're asking for would be something like an identification if you're a first responder, that type of, just to verify employment. But in terms of documentation for proof of chronic conditions, we're not asking for that.
Now, that having been said, we expect that the public will be honest,
Right.
and not just show up and claim to have one of the 1B criteria, because the people who have those illnesses really are at increased risk for a serious complication. That's why they're there. So if you show up and you lie, you're taking away from somebody who really needs it.
Thank you for joining us with COVID-19 Talk with local health authorities. We'll be right back.
If you love concerts and live theater, going to baseball games, and eating in restaurants, inside, if you love parties and the small talk with the guy who makes you iced coffee the right way, then wear a mask and let's beat this virus so we can get back to the things we... Mask up, America.
Hello, Houston. Now more than ever, communication with our neighbors is critical as we work together to prevent the spread of COVID-19. It's important to get updates about resources, testing, and safety practices. Sign up for neighborhood updates to receive automated voice and text messages in English and Spanish. This new resource is available for anyone interested in receiving messages without needing a smartphone or access to the internet, especially our seniors. To subscribe to neighborhood updates, call 311 today and enroll.
Things could be stranger, but I don't know how. I'm going through changes, through all of the strangeness. I'm going through changes now.
Wash, washy, wash, washy, wash. Scrub them while you sing this song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
Welcome back to COVID-19 Talk with local health authorities. Is there a centralized communications and strategic plan for this distribution?
Yeah, so there is a state distribution plan, but in terms of how we're actually operationalizing that plan, that's where there's not so much coordinated effort, and they need to link up. And so, unfortunately, in the absence of a national plan that sort of addresses both of those things, that's when you see sort of a fragmented process, like a semblance of what we're seeing right now. So we are very actively working collaboratively with our local stakeholders to ensure that we are addressing those populations in our community. But we desperately would have needed some sort of a better approach to roll out a comprehensive plan for both distribution and administration of the vaccine.
There are a couple of holes in it. So one is, a lot of vaccine went to the large hospitals, especially when it was the Pfizer vaccine that required the special refrigeration.
Correct.
And the hospitals have got the frontline workers taken. So that made sense, right, to get them there. And then also to the nursing homes, and that made sense because those are controlled environments. And they can control the vaccine, they can get it into their employees or their residents, depending on what the situation is. But as you start moving out into the general population, the vaccine, this is where the distribution plan and the vaccination plan need to be married much more closely than they are, because the assumption that if we get vaccine out to the neighborhood pharmacies and that they will then vaccinate everyone, or that we get them to physician offices and they will then vaccinate their patients, there's a number of holes in that, right? So one is not all doctors' offices signed up because guess what? Those are small businesses and you're giving them a whole bunch of more work that they hadn't planned on, and they don't have the number of hours in the day necessarily to do it. So that was a false assumption. And the other thing with the commercial pharmacies is they're also being tasked with doing a lot of the nursing homes, which is fine, but there's only so much they can do. And then the third thing is that there are communities, believe it or not, there are communities that don't have a Walgreens or a CVS or a Kroger. And you know what, those tend to be our most vulnerable communities that don't have that infrastructure there. So in retrospect, a couple of holes in it, but we're scrambling right now to fix it. Yeah.
Can we expect any federal intervention with manpower or financial support to enhance distribution processes? I think the answer to that is yes. Actually, with the last legislation that was passed, that should ensure at least some financial support comes in. And there has been some talk about bringing federal resources from a manpower perspective. Do we need to hire more people to do vaccines? Yes.
We do. Absolutely.
Can I just add, so I want people to think of this in three links of a chain. There's vaccine availability, vaccine being available. There is people and places and systems to actually vaccinate folks. And then there's a demand from the public, people showing up. And you got to have those three things. At any given time, one of those three links will be the rate limiting step. So a couple weeks ago, we had vaccine in the community, but we didn't have enough, places for us to go out and vaccinate folks. We quickly solved that. So today our problem is we don't have the vaccine anymore. Right. Once we got this solved, we consumed all the vaccine. And currently right now we got a whole bunch of folks who are asking for it. Right. But 3 weeks from now, maybe there'll be a whole bunch of vaccine, maybe we'll have a whole bunch of places to do it, and the demand will drop off because people are still waiting to see, sort of thing. Right. And then 3 weeks after that, all of a sudden the demand is going to. So each one of these three links is going to up and down on its own.
Are we safer getting a vaccine at a hospital where there is a doctor available in case of an allergic reaction?
Well, what I'll say is that based on what we've been seeing across our community, we have safeguards in place to be able to address any type of situation. Well, not any type of situation, but we certainly can address an emergency situation should something happen out in the field at our community distribution site. So I definitely don't want people to think that they have to go to a hospital just to get the vaccine. And just this morning, we were talking about the amount of the small amount of percentage of folks who've had severe, what we call anaphylaxis. I mean, when you talk about millions of doses that have gone out, and a small percentage of these most severe allergic reactions has really been minuscule. So I certainly don't want the community to think that they have to go to a hospital facility to get that they should feel safe going to the community structures that are in place as well.
Yeah, okay. The number that was reported came out. It just came out yesterday. It was 21 cases of anaphylaxis out of 1.89 million doses of vaccine given.
Oh, wow. That is small.
That's a tiny number.
So.
Some doctors say to wait 90 days after having COVID, and others say, don't wait, your vote.
Well, if you're a 1A or 1B, I would go more by the prioritization. So the talk of waiting 90 days comes from people who figure that if you get infected, you theoretically may have 90 days of immunity, right? And so then the argument is, well, if you got that immunity, then don't get the vaccine because you're taking it out of somebody else who needs it. That's where that conversation comes from.
Oh, okay.
That's right.
Yeah.
How sure are we that there will be vaccine available for shot 2, even if we have an appointment? Actually, at the time that the distribution occurs, there is a dose set aside for that second dose. So that shouldn't be a worry. What investment is needed to get the resources required for distribution? I think earlier you were talking about the differences between vaccine administration and distribution. I mean, the reality is that the distribution is actually occurring. The hiccup is really the administration of the vaccine.
Right.
Is there equitable distribution by state, or is Texas being shortchanged? We're not being shortchanged.
I don't think so, no.
Especially, and even at the state level, really, providers had to fill out forms that said who they would be vaccinating, and their estimates of the number of people within a certain sector of population, and the distribution is actually based on that.
And if I could just add another little perspective. So we here in the United States, we got to remember we are in a first world nation. And so, yeah, we're worrying if, did New Jersey get more than us or something? Remember, there are entire nations that today still don't have a plan to get vaccine because they have been outbid and by other nations. And so there are whole countries that still are scrambling to try to get an order in for vaccine.
What if you get a vaccine and didn't realize you were already positive?
You're good to go.
Yeah, you can still,
What's the pecking order for distributions? Hospitals, city, county? I think you mentioned earlier that
Yeah.
hospitals were targeted first because, go ahead.
Yeah, I was just going to say that hospitals were targeted first, especially with the Pfizer, because it is a platform that requires that special storage and handling, and not all vaccine providers have that capacity. And so that's why that allocation particularly went to the hospitals in a much larger quantity, because they also needed that quantity to ensure that their healthcare workforce was also vaccinated. So,
Thank you for joining us with COVID Talk with local health authorities. We'll be right back.
Day after day, we set our little routines. Small things we can't forget to do, or we can't afford not to do. We embed them in our brains. We repeat, for our safety, for our family's safety. We just added a few more for everyone's safety. Remember, every time helps, every day counts. Mask up, social distance, wash your hands, get tested, don't stop, don't forget.
Oscar the Grouch here to tell you, yeah, you, to wear a mask out in public around other people. Sure, it'll keep you healthy, but more importantly, I won't have to see your happy, smiling face. And if you don't want to wear a mask, I've just got one thing to tell you. Scram! Go away!
Caring for each other because we are all in this together.
So wear a mask and have a rotten day, will ya?
Wash your hands. Avoid sick people and touching your face. There are everyday actions to help prevent the spread of respiratory diseases. Visit cdc.gov/COVID-19. Brought to you by the National Association of Broadcasters and this station.
Food. It brings us together, inspires joy, and gives us life. But we can't forget that during this crisis, over 37 million people don't have access to nutritious food. That's 1 in 12 seniors and 1 in 7 children. In fact, millions of kids aren't able to receive a free or reduced price school lunch right now. The good thing is, we can all help. Learn how you can get involved at feedingamerica.org. When we help each other, we nourish ourselves, our families, and our communities.
Houston, we have a problem, more like a pandemic, and now it's all of our responsibility to make sure we end it. So this is a declaration, for others may not have a solution. This is Houston, and we must protect the H.
Welcome back with COVID-19 Talk with local health authorities. Interesting discussion during the break, but alcohol, does it help, hurt, have no effect on getting COVID? Does it have an adverse effect on the vaccine?
So what I will say about the COVID sort of risk, and what we've said about a lot of the prevention measures that we have in place for COVID, really centers around a lot of personal responsibilities. And so a lot of times when we talk about alcohol, we have to keep in mind that it does lower inhibitions. And so it means that if you're in a social gathering with folks, the ability for you to keep your mask on may be more difficult because of the alcohol having, that impact. And so it certainly puts you at a higher risk for contracting or even spreading COVID, especially if you're asymptomatic. But so that's really one of the big reasons why we want to make sure that people understand the importance of those prevention measures like wearing your mask. And so certainly understanding that alcohol can impact and sort of disrupt someone's ability to do those things is important. In terms of the vaccine and how how alcohol plays with the vaccine, we haven't seen much information or data about that, but I think it's really important to tie it back to the behavioral modifications and the behavioral things that are in play with ensuring that the prevention measures are kept.
Okay, I've heard 10 to 14 days after getting a vaccine, you start developing protection. Is that from the second shot or after the first shot?
So I actually, among some of my colleagues, my physician colleagues that have gotten vaccinated, they've been actually testing themselves for antibodies. And it sounds like in about 14 days you start developing some antibodies after the first shot. But that's not enough. So it takes about 14 days before you get any antibodies at all after the first shot, but you still require the second one.
That's right. You do need that second dose for full immunity.
What percentage of those who are eligible for the first dose are turning it down?
Well, I
don't have. Yeah.
That's the healthcare workers. Y'all have heard percentages related to that.
Yeah, so it sort of depends on who you ask.
Okay.
Whether you're talking about EMS folks or you're talking about hospital folks. So, and not only that, but every time I ask somebody, I get a different percentage. But it's not zero. It should be zero.
Right.
Okay. If I'm over 65, can I go to any location that is providing a vaccine?
Well, again, I think it goes back to what we were saying earlier. Not like even with the State Health Services locator map. Not just because someone is a vaccine provider doesn't mean they'll actually have vaccine. So there are a number of retail pharmacies, your physician's offices that may be signed up, but it doesn't necessarily mean. So I think it's important for people that are 65 and above to contact their physicians and their hospital partners to see if they can get their vaccine there.
The other thing is the state has not officially gone from the 1A to 1B yet. And so, yet at the same time, they told the 1As, those who are vaccinated, 1A get a vaccine. If you take care of all your 1As and you have vaccine left over, move on to the 1Bs because we don't want it sitting. But that's created some confusion. So officially, we've not moved to the 1B yet.
Methodist is giving a $500 bonus for healthcare workers who get the vaccine. Shouldn't that be a prerequisite to work? Should we force people to take the vaccine?
Well, so several hospitals in the area, when it comes to flu vaccine, they require their clinical-oriented people to get the flu vaccine in order to work. That's a mandate. But that is because within the law they can do that. Now, with the emergency use authorization, employers are not allowed to mandate. So Methodist in this case is given an incentive as opposed to the mandate.
Yeah.
Are the same people testing and vaccinating?
Well, I mean, I can say for our Harris County sites that we still have a number of testing sites in our community, and we've also stood up separate vaccine sites. So there's equal efforts of testing that's still happening across the community.
Yeah, I think the message here is that just because vaccine is available,
that's right.
You still have to practice certain behaviors.
Absolutely.
You still have to continue to test.
Absolutely.
A private non-hospital emergency facility charged me $175 for a COVID test. My insurance company was charged thousands for it. Is that unethical or price gouging? Because most of us don't look at the insurance statement. Who can we report this to?
So that's an excellent question.
Yeah. So unfortunately, we have heard those stories, and so I think that it's difficult to. It's unfortunate that it's happening, but it is something that individuals do need to talk to their third-party insurer about, because there does need to be transparency about pricing, especially when they are seeking testing at, at privately owned facilities. But unfortunately, it's something that we've been hearing about.
But if I get one thing, when it comes, that's testing. When it comes to being vaccinated, if somebody's asking you for money when you're being vaccinated, something is wrong.
That's right.
The consumer should not be expected to pay money to get vaccinated.
That's right.
They can charge your insurance company, they can charge Medicaid, Medicare, but they should not be charging you to get vaccinated.
And there are also free testing sites within the
That's right.
community, so seek
That's
those
right.
out. Please update us on the current status and the rollback restrictions for the county and the city. Is January 9th still the projected peak day? Haven't heard that.
Well, the rollback, you were talking about GA32,
G32 maybe? Yeah.
we crested that yesterday, I think. The
That's
letters went out to the hospitals yesterday, I know.
What is the herd immunity threshold?
So there have been a number of different mathematical models that basically have said that in order for the general population to either receive immunity, either from you catching the virus on your own from just from a high risk situation, or from getting the actual vaccine, that it's going to take about 60 to 80% of the population to reach that sort of protection. And so, like I said, it's either protection either from natural infection or from the vaccine. But the vaccine is going to be the best measure to get us there, not depending on people to get infected, because we don't want to risk, lives and things like that. So about 60 to 80% is the number that most models have been showing.
Okay, there's been talk about this more contagious strain. Any comments on that?
Well, the UK strain, there's two of them out there. There's the UK strain, which has gotten most of the media play, and it seems to be 50 to 70% more contagious, more easily spread. That is taken over in the UK, clearly, and it is here in the United States. There's at least 3 states, if not more, that I know of that have got it. But there's also a South African strain, which is supposed to be even more contagious. But that's very new. We don't know much about that yet.
Yeah, and I will say that what we know right now is that the vaccine is still effective with these variants or with these strains.
That was the second question.
Yeah.
Great. Dr. Hotez said we're in the third wave and this one is worse. Can you provide or elaborate on that?
Well, it ain't over yet, but it looks like it's going to be worse.
Yeah.
If we've been in contact with someone who tests positive, what is the latest guidance on how long I should stay in quarantine?
14 days.
Yeah, I was going to say the recommendation is
14
still
days?
Yeah, the
I was at
recommendation
a
is still
family
14 days.
gathering. No one had a mask on. No one was positive after 7 days. Do I still need to quarantine?
Yes. I mean,
well, wait a minute. If nobody was
positive.
No one was positive, but that is a high-risk situation for one. I mean, no one wearing masks, and we're still recommending that you limit those kind of gatherings, especially when no one is, because you're putting yourself in a situation. Because I guarantee you that with the rates that we're seeing, that it's likely that a lot of asymptomatic transmission is happening, and so.
Okay, I got 1 minute. I visited a relative on Christmas Eve who found out that he was positive during the visit. I started showing symptoms after 1 day. Is that possible or just an awful coincidence?
Yeah.
It's a little bit of a short incubation period, but it's still possible.
It is possible.
It is quite possible. Federally qualified health centers, there was a question about that. Actually, you could Google that. Federally qualified health centers are health centers that are geared to serve really people who are low income, are likely to not have access, and they get an extra pay rate actually from the government in order to be in service. What is the Harris County Medical Corp and what volunteer opportunities are available?
Yeah, so the Harris County Medical Corps, or the MRC, is basically a pool of volunteers, whether that's physicians, nurses, medical assistants, EMTs, who can volunteer their time, their talents, to really a number of efforts across the county. And so we've been utilizing them for testing for the community. We've also now been utilizing them as a resource to tap into for vaccination efforts. So they can contact our main office, and we can get them in contact with individuals who can get them signed up and credentialed to join the Medical Reserve Corps.
Thank you for joining us for COVID Talk with Local Health Authorities with our new health authority from Harris County, Dr. Sherri Onyiego, Dr. David Persse, representing the city of Houston. Thank you to the Rotary Club of Houston past president Kathy Finninger. I'm Stephen Williams, the director of the Houston Health Department. Look forward to talking to you next week.